What are the right fluid amounts for a child's dehydration? Imagine your child is feeling very tired, has a dry mouth, or is not urinating as much as usual. These could be signs of dehydration, which often happens during illnesses like stomach bugs. Knowing how much fluid to give can make a big difference in helping them recover safely. The amount of fluids depends on how dehydrated your child is and their weight. For mild dehydration, which means a small loss of body fluids, the goal is to replace about 3 to 5% of their total body water. You can do this with oral rehydration therapy, or ORT. This involves giving small sips of a special solution called oral rehydration solution, or ORS. The typical dose is about 50 milliliters per kilogram of your child's weight over 2 hours. For example, if your child weighs 20 kilograms, they should get around 1 liter of ORS during this time. The solution should contain about 50 to 90 milliequivalents per liter of sodium to help balance their electrolytes. Start with small amounts, like a teaspoon, and give it frequently. As they tolerate it, you can gradually increase the amount. After a few hours, check if they are better hydrated and decide if they need more fluids or medical help. If your child's dehydration is moderate, meaning they have lost about 6 to 9% of their body water, they still can often drink and tolerate fluids. In this case, the recommended amount is about 100 milliliters per kilogram of weight over 2 hours. Use a specially formulated ORS with a lower osmolarity, containing around 75 milliequivalents per liter of sodium and 75 millimoles per liter of glucose. This helps prevent further dehydration and replaces ongoing losses from diarrhea or vomiting. For children under 10 kilograms, give about 60 to 120 milliliters per diarrhea episode. For children over 10 kilograms, give about 120 to 240 milliliters. Continue offering fluids regularly, and if vomiting occurs, small frequent sips or a syringe can help improve tolerance. In cases of severe dehydration, which means losing 10% or more of body water, or if your child is in shock, this is a medical emergency. They need immediate intravenous fluids. The typical initial treatment is giving 20 milliliters per kilogram of isotonic fluids like normal saline or Ringer's lactate rapidly through a vein. This may be repeated depending on how they respond. Oral fluids alone are not enough at this stage until they stabilize. Once they are better, you can switch back to oral rehydration and continue with fluids to replace ongoing losses. After rehydration, your child's body needs ongoing fluids to meet daily needs and replace any continuing losses. Continue offering ORS or age-appropriate fluids regularly, encouraging them to drink as usual. Nutrition is also important, so keep feeding your child normally during recovery. If your child is vomiting, small sips or using a dropper can help. Sometimes, medications like ondansetron are used in clinical settings to reduce vomiting and help them tolerate fluids better. Remember, every child is different, and ongoing assessment is key. If your child is very young, has bloody diarrhea, or electrolyte imbalances, they need careful medical evaluation. In summary, the right fluid amount depends on how dehydrated your child is and their weight. Mild dehydration needs about 50 milliliters per kilogram over a few hours, moderate dehydration about 100 milliliters per kilogram, and severe cases requiring urgent Roman IV fluids. Always keep in mind that ongoing losses must be replaced, and feeding should continue. It is essential to seek medical advice, especially if dehydration is severe or if your child's condition does not improve quickly.